Okay, welcome back to our chapter 3 of the sickle cell series. What we are doing here is simply awareness about sickle cell. And in the previous chapters, that is chapter 1 and 2, we talked about, check out those two chapters. And now I'm going to talk about chapter 3 of my book. And under chapter 3, I majorly talked about recognizing signs and symptoms. There is recognizing signs and symptoms. How do you recognize signs and symptoms in this patient as a mother, as a caretaker? So here in this book, I said sickle cell disease can show up in many ways, and not everyone has the same experience. The experience with the other one is totally different from experience from another person. But I will try to bring about a lot of things you can really see and really understand that this might be a sign. But it's totally different experience from each person. Some people go months without any problem, while others have frequent complications. It's important to appreciate that. But knowing what to look out for can help you to act early and to avoid the serious issues. So let us go through the common signs and symptoms in simple terms. And one of it is pain episode. Sometimes we call it sickle cell crisis. It's the most common in many patients. This is one of the most common and feared symptoms, and the pain happens when sickle cells blocks the flow of blood, or blood that carries oxygen in those small vessels. Because we say these are sickle cells like a sickle, so they can't move smoothly in the red blood, in the blood vessels. So in that, they block blood flow to other areas. That's why these patients come with that pain. Nebajja n'obulumi olw'okuba tebafuna oxygen amala in the other side that has been blocked. It can affect the chest, n'ensonga lwaki you see them come with chest pain, It can affect the arms, it can affect the back. You can see a child crying because of backward pain, but those are called sickle cell crisis. Some come with joint pain, nga buli nnyingo emuluma. It is not kwekos, it's not that this child doesn't want to go to school, but this child or this person is in pain. And I want the caretaker to understand that's one of the symptoms. So when you see a child presenting with such pain that you have not really noticed, but you are just seeing that as a, please take the child for screening to the hospital for screening. If that pain feels like a sharp pain, deep and throbbing, and suddenly can last for hours or days. But remember, when that happens, you can help this child, one, by giving them a painkiller. So have a paracetamol in the house, Give the child enough water or drinking water to drink, hydrate. Hydration can help. Remember, these cells are clogging in the blood vessels. Tezikiriza musaayi tambula. So when you give this child water to hydrate themselves, it helps a lot. Warm compressions, bayiseko ekintu ekibuguma, they need that heat because coldness sometimes affects them and they get those serious pain. Give them a serious rest, and if this persists, take them to the hospital to see the doctor. Another signs and symptom is fatigue and weakness, and many people mistake this. They see these children with sickle cell very weak, very fatigued, and people think they don't want to do work, but they wake up when they are very weak, So because the body keep losing the red blood cells faster than they make them, so people often get tired and weak. As we said in the first chapter, that the normal red blood cells last in our body for 120 days, But people with sickle cell disease, because of the nature of the shape of their blood vessels, of their blood, red blood cells, they last less than 20 days, between 10 to 20 days. So because of that, there is a lot of breaking of these cells in the body, and they tend to come up with anemia, you know. And because of that, they will feel so tired, constant tiredness, shortness in breath, and dizziness. They will complain a lot of things. You understand? Another sign that they come with is swelling of the hands and the feet. And this is always often the first sign we see in children. You find their joints are swollen, you know, the dactyls, these fingers are swollen, you know, but parents don't take it for as a serious thing. But it's a signal that the blood flow to those areas, like to these small vessels, is blocked. So they tend to swell the joints, these small joints, and like that. So the swollen joints and what is a sign that a parent can look at, or a caretaker, to bring these children for test. Some of them, they have a puffy face, painful fingers and toes as some of the symptoms. Another symptom is frequent infections, you know, because the spleen help them to fight infection, and because these sickle cells sometimes pulled back to the spleen. These children with sickle cell tend to have a large spleen, you know, and because spleen is one of the things that fights infection in these children, it gets affected. So they end up coming every time with bacterial infections. So when you see that in a child, please watch for fever, cough, diarrhea, all those life-threatening infection in children. Opt for a screening of sickle cell in these children. Delayed growth and puberty, because these children tend to have a slow growth, you know. If you're not having, you know, enough oxygen supply, the body metabolic rate goes down. So these children tend to have low growth compared to their counterparts of the same age. Yellowing of eyes, we call it in English jaundice, or yellowing of the skin. It is because the red blood cells are being broken at a very high rate. So they tend to have that color, jaundice, as a byproduct of the breakdown of red blood cells. So it tends to show us that really there is something going on. Red blood cells are being broken down so high, so we tend to notice that on the eyes. They tend to be yellow in color. So look for that tinge of jaundice instead of having that white thing on the eyes. They tend to have vision problems as one of the things, because we said, because these cells are sickled, they block the blood flow to other organs, and an eye is an organ. So because that effect of blood flow is being interrupted, they tend to have vision issues. Are we there? So those are some of the signs that you will notice in these patients with sickle cell disease. So when you notice that, go and do a test if you have not done. When to see a doctor, you know, I want to talk about that, because these children stay home, cry, but the mother is not taking care to see the doctor. Go to hospital or to a clinic. Immediately you notice this. High fever, especially in children. Breathing difficulty. Severe pain that doesn't improve with your painkillers. Weakness in one side of the body. Seizures or convulsions, omwana yesikasika. Severe headache and confusion. Abdominal swelling. Once you notice any of those symptoms in these children of sickle cell or any child, please If not confirmed that he has sickle cell disease, please go and do that scoring test or take them to the hospital, see the doctor, let the doctor do the screening and tell you that the child is fine or the child has this issue but not sickle cell. I thank you. Let me see you in chapter 4. We discuss more about sickle cell.